Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. In this presentation, we are going to look at how to lower our blood sugar level naturally. It is very important for us to understand the basic concept of how carbohydrates work, what they do to our blood sugar levels in the body, and how we can adjust those things naturally without resorting to heavy doses of medications, or if you're on medications, maybe drastically reduce your medication levels. So let's begin with the feature presentation. Carbohydrates are basically starch, which comes from rice, pasta, potatoes, bananas, fruits, and a number of sources. Tortilla, naan, whatever is your favorite food. And here's what happens. In order to understand how carbohydrates affect your blood level, we need to see what happens to the blood glucose level. In order to determine that, there is an index called the glycemic index. Glycemic index tells us how quickly our blood sugar level rises when we take a certain carbohydrate. For example, baked potato loaded with everything, or a bowl of rice, or pasta, or naan, or white tortilla. So when you take those, how quickly it rises. So what they did was they took a glucose and gave that glucose to people, and whatever the level of the blood sugar that was reached at various intervals, like half hour, 1 hour, 1.5 hours, 2 hours, and 3 hours, that was considered as 100%. That's the maximum the blood sugar level can go up. But there are other fruits like dates, which can raise the blood sugar higher than just the glucose itself. Keeping that in mind, our aim is to minimize the rate at which the glucose level goes up, the level or the height up to which the glucose level goes up, how long the glucose level stays in our blood, because all of this is going to stimulate your pancreas to produce insulin. More glucose, more insulin, more deposition of fat in the body, and associated cardiovascular risk factors. So the key is to take this high glycemic index food that we eat and how we can bring down the glycemic index. This is the crux of the entire presentation. How do we lower our glycemic index of our daily food that we like to eat and that we want to consume, but at the same time we don't want to be running around with high blood sugar levels or 5 or 6 medications to keep the blood sugar level down. So I'm going to give you this secret. Just keep this in mind. And here is a chart which shows what is known as the glucose tolerance test, oral glucose tolerance test. This is what we used to do to diagnose diabetes in patients with suspected diabetes. We would give them 100 grams of glucose, or glucocola as it is called. They drink it, and every half hour we would do a finger stick and measure their blood sugar levels. And in a patient with a severe diabetes, the blood sugar starting level may be 250, and within an hour and a half it can jump to 350 or 400. So that is a very abnormal blood sugar response, because the more the blood sugar level is, there is more stimulation of insulin production, and if your body cannot produce insulin, then the blood sugar level shoots up. So in order to counterbalance that, here is the normal response, where your sugar may be like 90 to 100. The maximum it can go up to is like 150 milligrams at the end of an hour, and within a couple of hours it will come back to the normal level. So how do we accomplish bringing our blood sugar level down quickly, and also making sure that the blood sugar level doesn't go up? And here are some of the secrets. Number one, the more carbohydrates we stuff our stomach with, the higher is going to be the blood sugar level. Instead of eating 50 grams of carbohydrates, if we eat 100 grams of carbohydrates, your blood sugar level is going to be considerably higher, and it is going to stay higher for a longer time, and it is going to stimulate more insulin. That means all that extra glucose is going to be converted into fat. That's the fact. That's the fact. F-A-C-T. The first word I used was fat, F-A-T. Okay. So the first key element is to reduce our carbohydrate intake. But you need to consult with your specialist, especially if you have diabetes or low glucose levels, because only your doctor can advise you as to what needs to be done. So for most other people, if you reduce your carbohydrates by 25 to 30%, you can dramatically reduce the rate at which your glucose level goes up, how long it stays higher, and how long it takes for the glucose level to come down. The second is another important key factor is how do we reduce the glycemic index? The glycemic index is based upon the carbohydrate load. It is also based upon what other food products are there that is interfering with the absorption of the carbohydrates. In other words, if you just eat just like baked potato or pasta without any other food, then your blood sugar level is going to shoot up very quickly. It's going to stay higher for a longer time. It's going to stimulate more insulin. On the other hand, if that is combined with other fruits like beans, nuts, or salad, then that reduces the glycemic index of the overall lunch or the dinner, whatever you are having. Second point is to reduce the glycemic index. So we have one, reduce the carbohydrate, the load. So you almost cut down your carbohydrates by say like 20-30%. That will drastically reduce your blood sugar level and also keep the levels lower. And by increasing the amount of non-carbohydrate foods in our diet, it brings down the glycemic index. There are certain foods, which I'm going to show in a minute, which have a lower glycemic index. The glycemic index of glucose is supposed to be 100. That of like dates, I told you, is like 103. Carrots also have a very high glycemic index. So those are two things. The only other thing that can reduce your blood sugar level is exercise. When you exercise, your body uses glucose to provide energy. So when you continuously do low level exercise, you are continuously burning calories. As a result, the body uses the existing blood sugar to provide the energy. So these are some of the things that we need to keep in mind. So here's an important thing I want to say, that how do medications work in reducing the blood sugar level? And here's a little chart showing when they did a glucose tolerance test, which I told you about. You are given 100 grams of glucose. That's a lot of glucose to start with. Nowadays, we don't do this glucose tolerance test. We just measure the hemoglobin A1C to see how significantly your sugar is elevated on a sustained period or a period of month. So here is a glucose tolerance test in a diabetic patients where the sugar goes from 100 to 250, then it gradually comes down. And here's the one in teal is metformin, which reduces the glucose elevation and also keeps the glucose level low. So we can accomplish the same thing without taking medications in mild cases by reducing the amount of carbohydrate load. So the less the carbohydrate we eat, the lower is going to be the blood sugar. And if we reduce the glycemic index, which is the second aspect, then we can keep our blood sugar level down. The third point is by exercising, we bring down the blood sugar also because the body uses glucose for exercise. And here's a natural way to increase your bulk in your diet by using salads, fruits, and chickpeas and vegetables, and that will greatly enhance your dietary habits and keep your blood sugar level down and also reduce the glycemic index. We need to look at two things, the glycemic index and the blood sugar level. And here I went on an experiment. 2 years ago. My weight was like 186. I got sick and tired of just sitting in the house and gaining weight. So I went on an experiment of using salad with grilled meats of various kinds. Here we have salmon, here's turkey patty, and grilled chicken. There's one toast here, meatballs, and also we can also have like a lamb chops if you like that one. And by doing this over a period of 2 to 3 months, I was able to bring down my weight from 187 to 172 pounds. People were asking, "You okay?" Yes, I'm fine. Actually, I feel better now than I did when I was weighing 187 pounds. So, ladies and gentlemen, to summarize, let me give you 3 tips to keep your blood sugar levels low, keep your insulin requirements low, and help you to lose weight. Number 1, reduce the amount of carbohydrates you consume by 30 to 40%. Replace one meal with this choice of salad with grilled meat, because that has very little carbohydrates to talk about. Then when you eat your regular meal, make sure it is always combined with food products like beans, salad, that will reduce the glycemic index. So ladies and gentlemen, hopefully this will give you some tips on how you can, 1, keep your blood sugar level low, reduce your medication requirements, lose weight, and feel a lot better than you would otherwise. Thank you so much for watching this presentation, and I will see you in the next presentation. Please do subscribe to our YouTube channel.